things that we want to do to make the experience of filler application more comfortable is to numb the skin just a little bit. So we use a topical anesthetic, and we'll have you come in just a little bit before the procedure and just put this on, just a little bit like this, just to numb these areas where we're going to be doing the injections. Now, we actually put a numbing medicine in the injection itself to make the actual injection process more comfortable, but it's always better because of the little small needle sticks that we use to numb up the skin. So we're going to put a little bit on the upper lip here, just like this, and a little bit on the lower lip. So it's just like this. This is very effective, and a quick application of a topical anesthetic will go a long ways to making the procedure a lot more comfortable for you as the patient. So now that the patient's numbed up and ready for our procedure, we've spoken about what we want to do, what we hope to accomplish here. We've taken some before and after pictures. Now we're ready to get started. So the first thing we're going to do is just clean the skin here, and it's probably better to not come in with makeup when you have these procedures done, but it's okay if you do. We can just take it off, and we're ready to get started now. So the first thing we're going to do is we're going to use a substance called Radiesse. Radiesse is a wonderful filler. It's more durable and more long-lasting. It will maybe be twice as long as our hyaluronic acid products. So it has a great deal of advantages for use in the nasolabial fold areas. We also use Radiesse to help in the under eye area, on the cheeks, in this area to help build up the cheeks, and that's a nice application as well. Anywhere in the cheeks, along the jawline, anywhere where we have a volume deficit that we're looking to build up and hopefully have some enhanced filling for maybe as much as a year to a year and a half after the procedure. So we'll get started now. If you just hand me just a gauze, please. Now we've already mixed this up and have an anesthetic and another substance called epinephrine in this syringe, which will help diminish any kind of bruising and bleeding, as well as make it a lot more comfortable to do the procedure. So let's go ahead and get started here. And we're just going to start right here. And you might feel just a little pinch, not too much of one, and maybe a little pressure just going in. And then maybe put just a little pressure like this to just kind of mold the material. This is called calcium hydroxyapatite, and these little small particles, which are embedded in a gel matrix, will cause not only a filling effect, but they'll also cause a buildup of collagen in this area, and that's exactly what we want to have happen. We want to build collagen in this area and have a much more full look to it. I'm going to switch sides over here, and we're going to work on the other side now. Another little small injection right here, going right into the tissue, laying this out. That looks good. Now, a lot of times what we'll do is to try to smooth out the tissue, we'll just open your mouth a little bit, please. And I'm just going to do a little smushing along there to help even that out and make it look exactly like we want it to be. We'll do the same thing on the other side. So I like this material, just like I said, for this area in particular. It works really well. We can use it on the cheeks. You can actually use it on the hands as well for revolumization of the hands. It's also an excellent procedure for that. You can see that we've just created a little bit more volume here in our patient, and that's exactly the kind of look that we're wanting for this. I'm going to put just a little bit down in here to just help with this little angular fold right here. So if you just lay back again, just go right in here, and it kind of lifts the corners of her mouth just a bit there. Open your mouth one more time. Perfect. Sometimes the patient can feel a little bit of the material in here. It is an implant. We're putting something in. You might feel it for a couple of days. It doesn't feel uncomfortable or anything, but you can just feel just a little firmness of the tissue there. All right. That looks very good. I think we have a nice filling now. Okay, now we're ready to start on the filling of the lips here. This is one of the most popular facial rejuvenation procedures that we do. And we take a great deal of pride in individualizing this technique and procedure for our patients. People want different things, and it's not at all unusual to have our patients show up with magazines and show me 2 or 3 different pictures of lips that they think that they might like to reproduce. A lot of people are worried that they're going to look silly, or that it'll be too much, or that they'll look like a duck or something like that. And that, of course, is not what we want. Our goal is for you to look more attractive, not less attractive. And so the key here is to just go slowly, to not overdo it, and to have a natural beauty be able to come out. And that's what we're going to achieve here by just enhancing overall volume in her lips. So let's get started with that. We've already done our numbing, so her outer lips are fairly numb here. Lips are a little bit more sensitive, and we have to just be a little bit more cautious, but once again we've added an anesthetic solution in with this material here. In this case, this hyaluronic acid is Juvederm. Juvederm and Restylane are 2 excellent substances to use in the lips. They feel very natural. Your lips feel like lips. When you kiss someone, they don't feel like rubber, they don't feel hard, they just feel natural and are just more full. The effects of this should last for 6 to 12 months, and we'll get started doing that right now. So we're going to try to enhance the volume overall, maybe just a little pinching feeling right here, and just enhancing and slowly enlarging this area. We'll come down here and get the lateral sides. So I'm going to be moving back and forth a couple of times because I try to do one side at a time and then come over and match that up on the other side. We'll just do a little bit of tissue massage here to help with evening out the tissues. And so I think that her upper lip looks good. It's a little bit more full than it was before. And we'll move down to the lower lip now. Very good. Sometimes we'll have just a little bit of bleeding. If we have very much at all of that, we'll just put pressure and stop and maybe put a cold pack on there. And when we're finished, we'll put a cold compress on her lips to minimize swelling and any potential bruising. Excellent. So, a nice enhanced volume look. Doesn't look radically different, but it is definitely a more full look for her. So now what we want to do is to just do one last thing, and that's to enhance the columns that come down right in this area. It's a little bit more tender area, but it's well worth it when we do this procedure. Okay, I'm just going to put a little pressure there just for a second. We've done exactly what we want to do. We have a nice, subtle, but definite change in the contour of the lips, a little bit more fullness. And what she can expect is a little redness and swelling that probably for the most part will be gone by tomorrow morning. And we'll put a little ice pack on here and she'll be just in great shape. I'm going to set this down for just a second, make sure that we don't have any little nodules in her lips. One last check to be sure that all is well. Okay, and there you have it. Really beautiful, nicely enhanced lips, a softer nasolabial line area. This is exactly the kind of look that we want to have, and something that is reproducible over and over and over again. It's one of the foundational elements of facial rejuvenation. I encourage you, if you're thinking at all about any kind of rejuvenation process, to think about fillers and adding volume into your face. It will be well worth it, and we look forward to helping you at Aesthetica Medspa.